interesting, guys. 1/5 of U.S. teenagers have unhealthy cholesterol levels, all right? 1 out of every 5 kids have too high a cholesterol. Now, a lot of people go, well, when do you start screening your kid for cholesterol? When? Well, the current guidelines recommend that you actually start screening kids between the ages of 2 and 10. Yes, your little 2-year-old, you need to stick a needle in them, all right? And they're recommending that you screen the kids who, A, have a parent whose total cholesterol is higher than 240. All right, well, how many of you guys have high cholesterol? If any of you guys have high cholesterol, a total cholesterol over 240, your kid needs to be checked, all right? If there's a family history of cardiovascular disease prior to the age of 55 for men, or 65 for women. So if grandpa had a heart attack in his 50s, your grandkids need to start being screened for high cholesterol. If grandma had a heart attack before age 65, she also. Now, let's say you don't know your family history. Okay, whenever anybody says they're adopted or we don't know their family history, we assume they have something. All right, that's a shame. When you guys don't know your family history, you guys are screwed because the doctor's going to run every test on the book on you because he's going to be like, well, I have to assume your parents had Tay-Sachs. Or they had Crohn's, we will assume your parents had a disease just so we can run the test on you. But again, if you have no idea what your family history is, get the kids checked. Or if you don't know who dad was, a lot of us had some near misses back in school. If you think dad nowadays is running around out there having high cholesterol, you need to take your kid and get them screened. If your kid is overweight or obese, not a bad idea to check their cholesterol. Not a bad idea. And then, of course, if your child does have risk factors like diabetes, high blood pressure, and get this, if your child smokes cigarettes, all right, they just said screen between age 2 and 10. So if you have a 7-year-old that's smoking cigarettes, number one, you're screwed up, all right? You're a bad parent. But number 2, they should be checked for high cholesterol. Now, a lot of people say, well, wait a second. Are the cholesterol guidelines for kids the same as for grown-ups? Actually, no, they aren't. A child's cholesterol the total should be under 170. That's acceptable. They're starting to be borderline if they're between 170 and 199. And then it's considered high at 200 or greater. This is a little bit different than adults. But if your kid's cholesterol is under 170, they are good. All right? They're good. Now, their LDL cholesterol. Their LDL, which is the bad cholesterol, that needs to be less than 110. So when you guys do this blood test, and it's your child, their LDL, the bad cholesterol has to be 110. Now, I know a lot of people go, well, my total cholesterol is high because my good cholesterol is high, and it pushes it up. The problem is if you have high bad cholesterol, it's an independent risk factor that can still cause heart disease, so bad cholesterol has to be looked at, okay? High bad cholesterol would be 130 in a child. That's just too much, okay? So what should we do with our kids, all right? Should we screen them all the time? Should we screen them every year? Right now, they're saying the kids should be screened every 3 to 5 years if they're normal. If they're normal, you screen your kid at 3 to 5 years. So if they're 2, then screen them again when they're 5, then screen them again when they're 8. And then I'm a little confused at why they said between ages of 2 to 10. I think screen your teenagers. Absolutely screen your teenagers. Because that's when they start to listen to you less and they're off the baby food and off the formula and off the breast. These teenagers, they actually go into the fridge and eat food there. So, for them, I'd say still screen them. If any of your kids' cholesterol was borderline, screen them every year. Just recheck them, all right? Don't mess around. If your kid has high cholesterol, then you're going to do what we do with the grown-ups. You check them in 3 months, you check them in 6 months, and I also say have them see a cardiologist, all right? Now, believe it or not, we actually do medicate kids. I have a lot of parents that say, why would I check for cholesterol in my kid? There's no medications for them. Well, there actually is. And if your child has high cholesterol, we recommend them see a pediatric cardiologist, get tested, and we recommend very strict diet and exercise changes. Okay. Of course, diets that are, rich in fruit and vegetables and whole grains are great. This isn't on the list, but I give my kids fish oil. Fish oil now is in that gummy bear form. I think, what's it called? Little critters, or I don't know the name of the vitamins. I used to give them Flintstones, but I don't know if the Flintstones brand has the omega-3s. But there is a gummy bear that's just the omega-3s. Now, they don't taste good. All right, I got to tell you, they do not taste good. But just get that into your kid because then they're getting the omegas. Because if your kid won't sit there and eat salmon, and salmon is a great source of your omega-3s, you really can't shove it into them. Have them do those gummy bears, okay? Of course, lean meats And they say vegetable alternatives. Okay? I don't know what a vegetable alternative is unless we're talking about tofu. Tofu is disgusting. If you could get your kid to eat tofu, teach me how. All right? Tell them to eat their fish and their legumes. Yep, they need to eat their legumes. Dried beans, peas, etc. Nuts. All right? They can eat nuts. Nuts is good. Low-fat dairy milk. Limit the beverages and foods with added sugars. All right? You know, in the good old days, what did we used to eat? You know, when I grew up, my mom would make pork chops, right? You'd also have chicken liver we would eat. Another thing you used to do is you used to fry the fat. I forget the term that was, but you would eat that. That would be your starch. Count Chocula. I ate my Count Chocula and I had a Kool-Aid. You see, kids aren't eating the same like we used to, and that's why they're unhealthy. That's the problem. All right, you got to limit the commercially prepared baked goods, and you need to do the healthy snacks. When they're eating the processed meats or the frozen pizzas, that's not as healthy, as, regular stuff. And then exercise. Get those kids away from SpongeBob SquarePants. Get them away from iCarly. All right, get them away from the TV. One, it frees the TV up for you. But two, they need to get off their tushes. All right, get them away from the video games. They need to exercise. Now, a lot of kids, they don't play outside anymore because we think they're going to get abducted. Well, then stand out there with them. I remember the good old days. My mom would cook, right? And the problem is I wanted to get the hell out of the house because what she would cook would smell up the place. But mom would cook and would sit outside and play. Would be outside and playing. Fine. You guys have to go out there, maybe ride a bike with them. Maybe, I don't know, go jogging with them. Take the dog out. But you got to get your kids exercise. All right.